dealing with acute knee pain and swelling. So one thing that's super important if we're dealing with a new injury is to manage the swelling. A lot of the pain, a lot of the stiffness can come from just effusion in the joint, which basically just means that good stuff is getting in, but the bad stuff's not getting out. So we want to be able to clear that swelling. So we all know, or you should know, that you should elevate. Okay, this is another way to help clear some swelling. So this is called VooDoo Floss. Rock tape does a similar version to this. What I'm going to do is I'm going to start taping from below the joint and wrap up towards the heart. So same principles would apply with the ankle. I'm going to start with a little bit of overlap. Then from here, if this is 100% tension, generally I'm going to start off about 50% overlap on the tape. Not super tight. If you do have a tender kneecap, you can avoid the kneecap and go above. Once I get to the end of the tape, I'm just going to pull and tuck it into, go this side, tuck it into itself. Okay. From here, my favorite way to mobilize is if I'm helping the patient, I'll passively mobilize them. But if I'm using this on myself, I'll just prop my knee up and I'll push through range of motion, a bunch of different angles, as much as I can tolerate. Okay. And then I'll do the same thing with bending the knee. With an acute injury, this can be very tender, so you might have it just kind of passively weighting down, just kind of pushing the back of the knee towards the floor. You might use a little bit of pressure, not have nearly as much movement as I do, but we want to clear as much swelling as we can. Generally 2-ish minutes, and I'm taking it off. I do not want to leave this there all day. If you feel numbness or tingling, or you feel like your foot is getting really heavy, that's a good sign that you want to take that off. As soon as I take it off, you can even see some of the color coming back right away. You can feel the warmth changing, good fluid coming back in. I'll do this 2 to 3 times an hour if I'm doing it at home. With a patient, I'll do it 3 or 4 times in a session, depending on what they can tolerate, to clear as much of that swelling as we can. Again, blood is coming to that joint to provide everything it needs for healing, but we want to make sure that the old stuff, the byproducts of the healing process, that they get back towards the heart. Elevation, compression are great from that. So this is a VooDoo Floss or a rock floss elastic wrap, essentially. It's really great for clearing some swelling.